My name is Christina Borbet, and Rochelle and I co-direct the Pacific Southwest Mental Health Technology Transfer Center. We are here today for the session Integrating Cultural and Linguistic Competence, Leading from Where You Are. So thank you so much for joining. And since we are a new center and part of a new network, I did just want to share a little bit of information about who we are and how we can serve you. So the Pacific Southwest Mental Health Technology Transfer Center, we often use the acronym MHTTC. And we are a collaborative effort, and we're funded by the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. And they fund us federally to support resource development and dissemination, training and technical assistance, and workforce development for the mental health field. And so we are able to bring to you responsive and no-cost training and technical assistance through this federal initiative. And the network is regionally designed. And so we are serving you as part of the region that includes Arizona, California, Hawaii, Nevada, and all of the U.S. Pacific Island jurisdictions. So that's what we mean when we say Pacific Southwest. There are a number of other centers across the United States, but each region, each of the 10 geographic regions in the United States has an MHTTC, like ours, but also an addiction technology transfer center and a substance use prevention technology transfer center. So in our Pacific Southwest region, there are 3 centers that are collaboratively serving those workforces. Our goal at the MHTTC is to make sure that we're providing you with responsive training and technical assistance that meets the needs and the priorities of the mental health workforce in our region. We're very interested in your input, and we welcome your input today and on an ongoing basis. At the end of today's session, I'll share a little bit more information about how you can share your opinions and preferences with us. And through our MHTTC, we offer a variety of training and technical assistance and resources. I did just want to make sure that you had a sense of the variety of modalities that we're able to offer in addition to this webinar format. We offer a number of other resources as well as training opportunities and individual technical assistance. All of this information and the specific topics that we are able to provide learning opportunities about are on our webpage, and you'll find that information both probably when you registered and also when we wrap up today, you'll see the link to our Pacific Southwest MHTTC webpage. But all of our upcoming events and resources are posted there for your access. Right now, what I want to do is focus on what we're doing here today. So I want to, again, thank you for being here, and I'm going to introduce you to today's session leads. These are team members from our Pacific Southwest MHTTC. I'd like to welcome Rochelle Espiritu and Naomi Ortega team. So I'm going to hand it off to you two. Thank you.
Thank you, Christina. And so we can go on to the next slide. Welcome, everybody. My name is Rochelle Espiritu, and as Christina said, I'm the co-director for the MHTTC in the Pacific Southwest region. I'm also the founding partner of Change Matrix, which is a partner with CARS on the MHTTC. And we've been working together for over 5 years now, and so it's been a great partnership to be able to provide these capacity building opportunities to the field. My background is in clinical psychology and evaluation, and I've been doing work in the area of health equity and cultural competence for many years, so I'm excited to be able to share some thoughts and ideas with you on the webinar today. And I will pass it over to Naomi, my colleague.
Okay, well, so I'm Naomi Ortega team, and I work with Rochelle and the Change Matrix team as a change specialist, and I'm a knowledge transfer specialist with the MHTTC. My background is in maternal and child health, as well as in farm worker health and immigrant health and community health, and I've spent a lot of time working with community health centers too. I'm really excited to be here. I'm going to turn it back to you.
We'd love to hear a little bit about who you are. I'm going to advance us to the next slide. And I know a lot of you have already been putting in your role, your agency, and where you're located. And if you have any questions for us about cultural competence, diversity, inclusion, equity, things that are kind of related to this, that would be great. Go ahead and put those into the chat box. And the other fun question I'd like to ask you, since this is about leading from where you are, is when did you first know that you were a leader? I love asking these questions of groups because we get such a wide range of responses, and if you would like to share something, that would be great to know a little bit about when you experience that. And I'll share that my first experience of knowing that I was a leader, because I think we're all leaders in different settings, was when I was in high school and I joined our Asian club and decided to run for president. And I think I was a sophomore at that time. Was a little surprised that I did that and then just kind of slid into the role. And so it was a neat opportunity for me to work with other classmates and peers and help direct an effort that we were working on. When I ask this question of groups, sometimes I'll get memories back to Girl Scouts or Boy Scouts or other kinds of group activities like that, or that you just always knew you were. And so would love to hear a little bit about when did you first know that you were a leader? I see people typing, so I hope that means you're sharing with us. We will go on to the next slide, and I'll share a little bit about our objectives for the webinar today. During our call today, we're going to talk about providing culturally and linguistically appropriate behavioral services. So we always like to start off with getting on common ground and offering some definitions that we're working from, recognizing that every group will want to have those own conversations in your agencies and organizations, because it's so important to make sure you're talking about the same thing. We'll also talk a little bit about why cultural and linguistic competence is so important, and what makes an organization culturally and linguistically competent, and how to get there. And knowing that this is work that never ends, right? That it is a continuous learning journey that will be going on for a long time. We'll also want to explore how you might be talking about cultural competence, looking at your policies and our training opportunities, and note that without leadership at every single level, that it's hard for organizations to move into being culturally and linguistic competent. So that's kind of our general objectives. Those are our objectives for the webinar, and I'm going to pass it over to Naomi, and hopefully her phone is working well now, and she'll go over the agenda.
So our agenda for today, we are going to walk us through the basic definitions, as Rochelle shared, and talk about why culture and cultural linguistic competence are important. We want this to be as practical as possible for you all. So we will take some of these theoretical frameworks and help put them into practice by helping you see what steps to take to become a culturally and linguistically competent organization, and then help you learn how to lead the way. We will leave a little time for Q&A, questions and answers, hopefully, and then we'll wrap up from there.
So thanks to those of you who shared a little bit about how you knew you were a leader. I think that's great. We're going to explore leadership with you during this presentation, and even with the follow-up community of practice that we'll talk a little bit more about later on. But this webinar is being offered as a webinar that will have a follow-up community of practice that will provide some space for more in-depth conversation and peer opportunities. And so just be thinking about that as we go through some of the content, and recognize that we can't get into too much depth during this 1-hour webinar, and we wanted to make sure we offered opportunity for you to explore more, practice, and then come back and reflect on learning. So in terms of adaptive leadership, why is this so important? Well, we know that flexible and adaptive leadership is becoming more important for most managers and administrators, and really everyone, as we are in these environments that are constantly changing, right? And so we want to make sure that we can mobilize and support people in change. We want to make sure people are able to ask difficult questions and not necessarily feel like you as a leader always have to offer all the solutions. In adaptive leadership, we also know that you have to help people come to a shared vision of where you want to go, and through shared values. Adaptive leadership makes us kind of reevaluate what our values are and our attitudes and our thoughts about leadership, and make sure that we're looking at multiple views of any situation. So what we'll be asking of you is to consider how you make those shifts that need to occur among your personnel and your policies, in the structures and practices of your organization, and the work that you do within your communities. And so what we're encouraging essentially is maybe a reset. So we'll go ahead now and dive into some of the definitions around culture and cultural and linguistic competence. So we'll look at this, what it is, what CLC is, and why it's important. So the iceberg has often been used as a metaphor for culture. And what you can see here is that 1/10 of the iceberg is above water, and that can help you think about the 1/10 of what we can consciously see about anyone's cultural identity. And just as the other 9/10 of the iceberg is below the water and not visible, so is the other 9/10 of a person's cultural identity. That's not necessarily in our awareness. And like an iceberg, only a fraction of culture is visible. It's usually the customs, the language, the physical experience, while the things below are usually things like deep held values and preferences. And so culture is really, the main message here is that it's broader than what you can usually see. And we offer that definition of culture for you there as well. We also know that culture is much more than ethnicity and race. Culture represents a pattern, those patterns of being for a group of people and how those patterns are expressed. So culture can refer to age, a lifestyle approach, gender identity, spiritual identity, psychological and social practice. It can also refer to a work ethic or an approach or belief system around recycling or conservation of resources. So there are many ways that you can think about culture. Essentially, it is the lens through which we see the world. It shapes our experiences, our perceptions, and how we interact with each other. It's basically how groups of people believe, think, and act, and also how we seek care or provide care. And it's also true that not everyone in a group will think or behave in exactly the same way, which makes it so complex.
One thing I didn't think about with the iceberg is it's kind of a cold image, but culture is such a warm thing, Rochelle. What role does culture play in behavioral health? It's really an important question for us to start with because, as Rochelle said, culture is the lens through which we see the world. And relevant to behavioral health, it affects the way that we think about disease and wellness and how we interact with people, how we seek care, how we provide care. So culture and life experiences can affect our trust and faith in the behavioral healthcare system and the people providing services. Let's start off by making sure, or let's continue by making sure that we're working with a shared understanding of cultural and linguistic competence. And we'll use this definition, which talks about having the capacity, so which at a minimum, and Rochelle talked about some of these things, includes knowledge, skills, abilities, behaviors, attitudes. So the capacity to be able to respond effectively to one another. And it's not just in a way that we are comfortable or familiar with ourselves, but really about interacting within other people's contexts and cultures. So that's really the foundation of cultural linguistic competence. And before we move on, you'll probably see on many of the slides CLC, which I'm sure you know, but just I like to make sure we're on the same page. That's the abbreviation that we're using for cultural and linguistic competence. As we talk about cultural and linguistic competence, we'd like to encourage us all to think about it not as something that you either have or you don't have, but as this continuum. So this is a more modern version of the continuum than some of you might have seen before. It starts us off with cultural awareness, which is a desire to engage in the process of becoming more knowledgeable and skilled, and then taking those steps toward becoming more aware, such as doing individual and organizational self-assessments, which we'll talk a little bit more about later as well. So as we learn and we do more, we move on to cultural sensitivity, or knowledge, which involves learning about other cultures and perspectives and recognizing the value of interacting in a way that takes other people and cultures into consideration. So it's a lot about looking at the other context, not just our own. The next phase we grow into is cultural competency or skill. At this point, we start to develop those skills and the ability to actually use the knowledge and the skills, and we start to practice that with more intention. And that brings us to cultural humility, which isn't an end or an end goal, but it's really a lifelong commitment to learning, to continuing to meet each other where we are, and it's a continual process of evaluating where we are, how we're doing, and what else can we do to continue learning and growing. And it's also about how we share that power to create a mutual understanding and environment. We know not only, unfortunately, from many people's firsthand experience, but also through published studies, that racial and ethnic minorities tend to receive a lower quality of health care than non-minorities. And that's even when we consider factors related to access, such as patient insurance and income. So in addition to helping us save money, avoiding health complications, providing culturally and linguistically competent care at a systems level can translate into positive health outcomes throughout the community, as well as staff who are happy, fulfilled, and stay in their jobs. And also it can translate into successful partnerships and opportunities that help everyone work toward a shared goal. So ultimately, cultural and linguistic competence is important because it can lead to increased respect, creativity, participation from diverse groups, trust, and inclusion. So now we'll talk a little bit about how you actually move towards becoming a culturally and linguistically competent organization. We'll introduce a framework and a few practical ideas that allow us to take these theoretical concepts and translate them into real life, individually and as an organization. So while cultural competence is important, it's really important that we not think about it as a separate theoretical concept, just something we learn about. It's only meaningful if we look at it as a lifelong commitment and as part of a process rather than an end goal, which is what we were just talking about, and is an integral part of really all that we think and do. Okay, so let's take a little step back and envision what a culturally and linguistically competent organization looks like. We've included an image on the right side of your screen to underscore that it's really important that cultural and linguistic competence be comprehensive, that it permeates all levels. So you'll see that individual, organizational, community, and that broader systems level. And then on the left side, we're alluding to a set of standards that were designed to help guide organizations in this comprehensive approach to providing culturally and linguistically competent care. So those standards are called the CLAS standards, which is an abbreviation for the National Standards for Culturally and Linguistically Appropriate Services in Healthcare. And ultimately, the standards help us see that culturally and linguistically competent organizations provide equitable, respectful care that is responsive to diverse needs, have leadership to promote these CLAS standards and to promote health equity at all levels, have staff who are culturally competent, have organizational policies and structures that are responsive to the populations being served, and culturally and linguistically competent organizations really involve the community, and they consistently actually use data that they collect in order to experience ongoing improvement that enables them to continue being responsive to the diverse and changing communities they serve. So we wanted to highlight this resource. Hopefully some of you are recognizing this image a little bit. This is a really great complement to today's session. We recently developed this and tailored it for you all for the Pacific Southwest community of organizations. So it's a Pacific Southwest MHTTC product, and it's a package of resources for planning, implementing, and evaluating the integration of cultural and linguistic competence into mental health service delivery. The resource package is organized around these goals or performance areas that are listed on the left side of your screen, and those are the areas that are based on the CLAS standards. If you join us for the communities of practice, which I think we mentioned earlier, we're going to dive much further into each of these areas, and we'll invite you to share challenges, innovative strategies, and your organization's experiences in those areas. So Rochelle, I'd actually like to pass it back to you so we can talk a little bit more about how to pull together what we've just been talking about into something that people can really use in their own communities and organizations.
Great. Thank you, Naomi. And so what we'd like to offer here is a way of thinking about how you approach this work. And this is a framework from SAMHSA that is a strategic prevention framework. And we like it because it's a circular process. It's recognizing, again, that this is not linear work and that there are lots of different pieces that intersect with each other along the way. As you think about how to lead efforts in culturally and linguistically competent care into your organization, we'll encourage you to think about this journey in small and measurable steps so that you can find success as you're moving forward in this change process. What you'll see here is these various elements, which we'll go through in more detail, but we've got assessment at both an organizational, an individual, and community level. We'll look at how you can plan and engage with the diverse stakeholders that you might be working with, how you build capacity to meet the needs of your population, including your workforce, what it'll look like to then implement the work, and how you continue to learn from the work that you're doing. Hopefully this will sound familiar to what Naomi talked about earlier in terms of moving from awareness to sensitivity, competency, and humility. And this is one way of looking at the steps that we take to show how we go about doing that. In terms of getting started, we like to always think about creating that sense of urgency. Like, what is the story or the narrative that is going to hook people into the work that you want to do around cultural competence? And how are you going to help to lead that effort? So you might need to engage different champions in the work. It might be the leader of your organization, or it might not. You might have some unauthorized leaders in the organization or agency who you know are really committed to this work, and engaging with them would be really important. So I encourage you to think broadly about who the leaders are in your organization. And then pull together those folks into a conversation, and maybe start a team or a committee that can be charged with creating a shared vision for the organization. As you think about this step of the work, I encourage you to think about all those goal areas that Naomi mentioned earlier around governance and leadership and workforce, community engagement, language communication, all those things. We'll dive into more detail about how that looks, again, in those communities of practice. And so in the next slide, you'll see that we often think about this work as adapting really to a new way of being and to acquire that new awareness and knowledge and change attitudes potentially and develop new skills. And so that adaptive work really requires us to have those opportunities to learn, to reflect, to apply, and then to practice. And so first, you really need to know where your organization is in terms of your team members' awareness and attitudes and understanding related to cultural competence. So an assessment is this opportunity to look at your own beliefs, an opportunity to think about individually where the organization is on that cultural competence spectrum we shared earlier, and a chance for you to do that collectively. So some questions to ask yourselves might be things like, how diverse is our organization's workforce and leadership? How do our policies effectively support cultural and linguistic competence in all that we do? And do our programs and services use approaches that are relevant or informed by our community? And so as leaders in your organization, encourage you to embark on those conversations and those questions, and keep in mind that this assessment process can take time. Often we're eager to just get going and move forward quickly, and this step is important so that you have common ground in terms of where you're starting. So let's go on to the next part of this framework, which is around planning. After you've done some of that assessment of your organization and reflect on the findings, you can begin to plan. You can use that data to inform your actions. And so you'll want to make sure you've gathered input from all levels of the organization, and ideally from the community. So you might do something like a one-day coalition building session to help you all come together and come to consensus on common language around your expectations, what the structures are, how you're going to communicate with each other. So you'll just want to come up with a plan that is specific with your timelines and who's going to be involved. Oftentimes we talk about the work of cultural competence as feeling so complex that sometimes we feel paralyzed by the effort. And our advice to groups is usually like, just start somewhere. Find where there's some traction or some space or something that happened that gives you the leverage or the interest to start doing something. And then you can start to think about it in a really comprehensive way, if that's an easier way for you to start. This is often where we see organizations interested in starting, right? Like there's an interest in getting some training for staff around a particular need to build that capacity of your workforce. And I think that's great. And what we always encourage folks to think about is how does that fit within an overall strategic framework, because it's just one piece of the work that has to be done. As you think about the capacity of those in your organization, think about things like how are we going to increase the workforce ability to meet the needs of our vulnerable populations. That might look like training for all staff to ensure that they have that common understanding, what it looks like, how to move in the direction as professionals. You might engage in facilitated discussions about identity, power, and privilege. As you think about your role or as a leader in this work, like how do you lean into some of those challenging conversations that require a certain amount of vulnerability to have? You might even suggest having informal book clubs or movie discussions as a way to provide an initial space to have conversations. And we've shared lists of books and movies with folks before that can provide that starting point. You'll also want to be looking at how do you recruit and retain and promote diverse staff and leadership at all levels of your organization. And I know sometimes this can be really hard because you have defined roles and you have people already hired who are in your space. So then that goes back to, well, then how do you create the training opportunities and the capacity building for folks who are there? But you might find that as you are working with your teams that maybe some job roles and functions might shift around a little bit because there are strengths that one person has that could help enhance an effort that's going on. And then just kind of be thinking about how do you continuously learn as an organization around some of those innovative approaches that are meeting the needs and are culturally appropriate, that resonate with the community that you're providing services for. So those are just some initial capacity ideas. We can move into implementation. So often a lot of these things are happening simultaneously, so it feels a little odd to talk about it in this straight way, but you all understand. The other part of implementing is like how do you look at the changes that you're making and the services that you've planned for and for which you've built the capacity around in your workforce. As you're looking at implementation, you're looking at your services, you're making sure they're accessible, you are wanting to make sure that they're accessible both in terms of language also and in terms of being adapted to meet the needs of specific populations and the community. And then the last piece of the framework around evaluation. And we like to think about evaluation as just always happening, and organizations that are eager to embark on this journey are really creating a culture of learning that allows people to sometimes make mistakes, which will happen, and giving the space to hold that stress. As a leader, I think that's one of the things that's so important, is to think about how you use evaluation and data and information to help your teams grow, and to think about creating learning environments for folks, such that oftentimes evaluation is looked at as punitive, or we're not reaching our numbers, or all the gaps that are happening, and yet each time there's opportunity to figure out how to improve and think about things differently or ask people different questions too. So you'll want to, at this time, be gathering information about who's engaged in your community and the services, what's important to them, how do you find out if you're meeting their needs, and what can you do to continuously make things better? That's the core of evaluation. We'll start talking a little bit more about CLC services and supports, and think about, as leaders in this work, what does this mean for community members and participants in services? Pass it over to Naomi.
Great, thanks, Rochelle. So keeping in mind that on those, just to plug them again, communities of practice, we will go into this in much more detail. What Rochelle was talking about, a lot of that goes on the inside of the organization, which some of it is visible to others, but what does that look like in terms of the services that we're offering and how we're interacting with participants or patients and the community? So these are just a few ways that you can actually see or experience those benefits of a culturally and linguistically competent organizational approach. And then actually there are some things that Rochelle was talking about under capacity building, some of the activities that you might do with staff to broach cultural issues. You might actually even offer some of those to the community as a way of inviting them in. These examples of creating an inviting cultural feel depending on who's in your community, making sure that your hours of operation or the programs that you're offering in the community meet the needs of the community. If you have Monday through Friday 9 to 5 and nobody can really meet those hours, some of your work might be adapting, finding out what does work for the community, being conscious of language and making sure that if you're providing services in one language but there are other languages in your community, that you're really exploring that as well. So what are some other ideas that you can think of in terms of how you can externally, how you can offer services and supports to the community in ways that are culturally and linguistically competent? And just kind of give you a moment in your experiences, what are some of the things that you've either thought about doing or that you've implemented? How does cultural linguistic competence show up for you all in your programming? I see some folks writing in. It's also how you're, not just the services, let's say, that you're offering, but how you're reaching out to the community. I've seen some organizations do little photo novellas in different languages that might be one page. Conducting a youth cultural cafe. Since that already happened, that would be great. I'd love to learn more about that. Okay. Any other ways? That can be a great way of connecting with a particular part of the population as well, and tailoring things to youth. All right, well, why don't we move on? If anyone thinks of any other ways that cultural linguistic competence shows up in your organization or your community, feel free to continue writing in. Let's talk a little bit about leading the way to cultural linguistic competence in your organization and your community. So creating multicultural organizations really makes us deal with, or I guess gives us the opportunity to deal with differences and to use them to strengthen our efforts. In fact, sometimes it means having difficult conversations in order to learn more about ourselves and about other people, and going a little out of our comfort zone or beyond what we're used to doing or thinking. And that's partly why, to reach these goals under cultural and linguistic competence, you really need a plan of action and strong leadership, which does mean a commitment from people who run the organization and programs. But as Rochelle mentioned earlier, and as we've talked about, it's important not to limit what we think of as leadership, because really we can all play a leadership role. But leadership involvement has actually been linked to the success of organizational efforts towards cultural linguistic competence. Research has shown, for example, that the commitment of leadership is the most significant element in an organization's ability to actually integrate cultural competency, and that the most successful cultural competence efforts have that real commitment, that visible commitment from organizational leaders. So what else is important in leading the way to cultural linguistic competence? These are a few of the key elements in addition to making a visible leadership commitment. Developing collaborative relationships within the community is a pretty important one, especially as a better way of understanding and connecting with your community and with other organizations in the community who are working closely with different groups in the community. So as we said earlier, leadership can show up at various levels, and also among program participants and community members. Sometimes they take a leadership role. So really, it's important to make sure to share the work and power to communicate what you're doing and communicate across the organization and with the community, and within your organization show that you truly value staff at all levels. There's a saying in theater that there are no small parts, only small people, but so it's really even the person who's all the way in the back or who's pulling the curtain couldn't do the show without them, and it's really the same in organizations. Everyone is very important. So remember that...
Naomi, I just want to share a story that sparked a memory for me when you said that, was that I was working with a community-based organization that had worked with their front staff. Like we often talk about lots of our trainings are for providers, and I think we've been sharing here, like it's so important to engage everyone in this work. And one organization retitled the role of their front staff to Director of First Impressions. And I thought that was I think that is so important because it elevates the importance of the role. Like when you first walk into an agency and who you're going to meet, it's so important that the environment that's created and the welcome and how you engage with program participants right there is so crucial. And I loved the way they reframed thinking about the importance of their role. I like that a lot. I was just thinking about that when you were chatting.
Yeah, they're sort of like ambassadors of the organization, really, and often know the community better than some other people in the organization. So very true. The last point I want to make for right now about leading the way is just to be patient with yourselves and others, and remember that change and really demonstrating commitment take time and continued effort. Rochelle, I'm going to turn this over to you, so hopefully we have some questions from our participants.
Yeah. Great. And I know that we tried to cover quite a bit of content in a short amount of time, and for some of you who have been doing this work for a while, it might have felt introductory, and we knew we had a wide audience on this webinar today. So we appreciate you joining us. We want to hear from you about what your interests or questions are on the information that we shared so that we can have some dialogue. And we'll also save some time to share with you at the end of this webinar a little bit more detail about the communities of practice and why we think it'd be great for you to join them and participate with us in continued dialogue. And I know sometimes it can feel a little daunting to do this in a webinar format, which is also the other reason why we want to do a community of practice, to create a little bit of a smaller, intimate space to explore and to maybe be a little vulnerable. And as we're waiting, I will put forth a question that came up for us recently. As a mental health technology transfer center, we're all asked to create an advisory board for our centers. And one of the questions that came up from one of our team members during our first meeting was, what are some of the things that we can do to engage and create safe and brave spaces for our immigrant and refugee populations? I think that was a very helpful question for us and a reminder of the other stressors and challenges that our immigrant and refugee populations can be facing. And so as you think about your organization, again, at all these different levels that we just went over in the presentation, thinking about how do you first engage immigrant and refugee populations, and maybe even thinking about how you provide safe space and services for them. So thinking about how do you reach out to trusted members in that community, how you do an assessment to understand what are some of those challenges that are being faced by them. And they're constantly changing too, and as you think about maybe the changing demographics in your community, so important to be kind of constantly looking at that and where you go for information. I think always, as you think about evaluation from an equity lens, it's like who's defining what the issues are and what are the questions that you're asking. So we've started to pull some information together for organizations as they consider how to work with these populations, and Naomi and I would be happy to share those as a follow-up too if folks are interested. I'm just looking into the chat box though to see if there are any other questions, and I know you're still there, so if you have any, feel free to type those in or unmute yourself on the line.
Rochelle, this is Christina. I wonder if as folks are kind of reflecting on pieces, we could tie this to the opportunity for those questions to be part of what will emerge as the community of practice from this session. Because it did seem like, in addition to being able to have this conversation today, we are proposing to bring to the field an opportunity for deeper connection on these topics through a community of practice that we're building, and having a sense of what are the challenges in the work, what are the opportunities in the work, kind of where this fits into the spectrum of priorities that no doubt folks are fielding, that can kind of also help us design what a community of practice might evolve into.
Yeah, absolutely. Happy to show those slides. As people think of any questions still, feel free to put those in the chat box, and maybe we can move on to the next slide so we can share a little bit more about the specific communities of practice that we're planning.
Yeah, we're really excited about this. There's a few opportunities. As a follow-up to today's webinar, starting in May, there will be the community of practice that we've mentioned many times because we're so excited about it. It'll be once a month, the second Wednesday of each month from 3 to 4:30 Pacific time. So we'll really have a little bit more time for that dialogue. And then we're also doing a webinar next week at this time on building a diverse workforce from the ground up. So we'll have the same kind of format. We'll have a 1-hour webinar, and then we'll have communities of practice that'll start a little bit later in the month of May, and it'll be once a month as well for an hour and a half, and that'll be on the 4th Wednesday of each month. And you can even participate in both of those if you want.
So Rochelle is going to unpack a little bit more about what do we mean by community of practice and why folks might want to join and what they'll get out of it. But I think it is important just to underscore that we are building a community. So we're asking folks to make a commitment, and we're asking folks to be part of that community on a consistent basis. And so we did create a registration link for that so that we could have a sense of what that cohort would look like. It's on the slide, and then we'll also be sending out an announcement follow-up to folks who participated in today's session. Rochelle, I'll turn it over to you in terms of just talking folks through what do we mean by community of practice and why folks might want to consider joining, and again, welcome their input to helping us define the discussion topics for those sessions.
Thank you both. So I love communities of practice because I often leave webinars feeling like, okay, that was good, and how do I bring this into my daily practice? And so we wanted to make sure we offered this opportunity for folks to get together in a smaller setting to build community, really talk to each other, maybe find or connect with people who are doing similar work as you are, and or maybe even focusing on similar populations. We do have some focused discussion topics, so you will know what the topics are each month, and they are related to the frameworks that we've been providing throughout this particular session. But what we love about communities of practice is that it gives you opportunity to take what you've learned, to talk a little bit about how it applies in your setting, and then to practice it, to actually do some work in between sessions, and then have a group of peers who you can share with afterwards and reflect on what it was like, and to maybe get some additional tools or resources to help you along in this journey. So we're excited to be able to offer this because it allows a little bit more of some of that intensive work that I think is so important as organizations are exploring this topic area and engaging in this kind of change. So we encourage you to consider joining us. We hope that you will find value in it and a space to be exploring some things that maybe you are interested in exploring more, and have the opportunity to engage with peers across the Pacific Southwest region. I'm not seeing any questions, so I'm going to go ahead and turn it back to you, Christina, to offer more information.
Well, I was just going to say the one thing I did just want to highlight for folks is that I feel like that it's, well, I don't know what your calendars look like, but if I don't have something on my calendar, and that it's really hard for me to follow through and actually take the next steps. And so having that time carved out to really focus on how to apply the framework, I think, is really valuable. So I wanted to thank you, Rochelle and Naomi, for kicking us off with this webinar, and then also just for kind of thinking the next steps down the road for how do we make this real? Like, how do we dig in and really unpack this work and make sure that folks have a space where they can elevate that and make it the priority for that time. So thank you. I wanted to just share a couple other pieces with you all before we transition to other things today. First is I wanted to let you know that this session has been recorded, and it will be available to access on our webpage within a few weeks. It's also going to be promoted through our newsletters. If you want to get more information about that or share this opportunity with others, it'll be available in the archived format. And then I also just wanted to remind you, as I mentioned, our webpage includes a lot more information about upcoming distance learning sessions. It contains products and resources that might be useful for you, and so I wanted you to take time to take a look at that. And then, as I indicated earlier on, we are really trying to build a repertoire of learning opportunities that is meaningful to you. And so that means we need your opinions about what matters to you, what you're interested in learning more about, what your priorities are for professional development. We have an online needs query that you can see here, and you can also find through our webpage, where it's going to be open on a rolling basis so that as you continue to evolve your opinions or priorities continue to emerge, that you can keep us updated. And we're using that input to design our scope of work. So basically the content and the topics that we're covering through the Mental Health Technology Transfer Center are being defined by you. So please share your voice so that we can make sure that the content and the modalities are responsive to what you want to see. And then I wanted to just land on something that is really important to our whole team. This final and very important piece is about how we get to continue offering these no-cost learning opportunities. So it really depends on completed feedback forms from each of our participants in all of our sessions. So that's you guys. The form that we are required to use by SAMHSA, our funder, is really quick and easy to complete, and it just pops up on your screen after you close out from this session. But before you do that, I wanted to highlight one or a couple tricky things. So because it's a federal form, there's all sorts of requirements and hoops to jump through. We are required to use a form that's from our sister organization, the Addiction Technology Transfer Center. So you're going to see the term addiction pop up in that form, and you're going to mentally swap that out with the term mental health, because that's what our focus is. The funder is not able to update the form with the correct terms yet. It's coming later this year, but it is still critically important to us that we have your feedback on our services today. It means we get to continue to improve what we offer you, and then also it makes sure that we can provide them to you and your colleagues at no cost through the federal funding. So again, our contract hinges on your completion of the feedback form. So if you could take a few minutes and complete it, we'd be so grateful, and that will ensure that we're able to continue providing these services. So a couple different opportunities there for ongoing participation, for expressing your opinions about what we should be offering, and then also ensuring that we can offer those at no cost to you by completing that feedback form. So I think that's it for today. Again, Naomi and Rochelle, thank you so much for making this really big topic manageable and sharing the framework with us, and I'm really excited about going deeper into the work through the community of practice on this topic.
Great. Thank you, Christina, and thank you, Naomi, for allowing this opportunity for us, and thank you to all the participants. We hope we get to see you on one of the follow-up communities of practice, and we hope everyone has a great rest of your day.
Bye-bye.
Bye. Thanks, everybody.
Bye-bye.